record on the computer. Okay, so we're live. Okay, so welcome to another episode of Lunchtime Social Science. Today Cody and I are joined by Andreas Peichl, who is the director of the Ifo Center for Macroeconomics and a professor of macroeconomics and public finance at the University of Munich in Germany. So we're happy to have you here with us, virtually, of course, Andreas. And I would suppose our goal today is to kind of talk in kind of general terms, but maybe even with a lot of specificity on the German experience, broadly defined. And so I figured we would start where everyone might be interested in starting. So, Germany has, at least early on, appeared to be this kind of anomaly in a sense that there are lots of infections, but very few deaths, at least relative to its neighbors and some of the experiences that we've seen elsewhere. So I wonder if you might talk just a little bit. I know this is not your area of expertise, but you are there kind of living the experience. I wonder if you could talk a little bit about, what's the situation like in Germany and why is the observed mortality rate so much lower in Germany compared to, say, Italy or Spain or France or even the UK?
Yeah, so thanks for having me. Thanks for inviting me. This is obviously something that's interesting interesting many people, that why is this mortality rate so low? And I think especially at the beginning there were at least two reasons. So I think in general Germany was from the beginning doing more testing on average than other countries. So that's I think the number of reported infections was higher, or the number of not discovered infections was lower. And so this leads to this. But I think the more important thing is that we sort of imported a big chunk of the infections from people who went skiing in Austria and Italy, and then came back and brought the infection back to Germany. And people who go skiing in the mountains are usually younger and healthier on average than the average population. So a lot of the infections at the beginning were among very younger and fitter people, and we know that there's a big gradient by age in the mortality rate. So I think that was also something in the very beginning, and it took some time until we had the first cases, and especially then also fatalities among older people. So I think that's the more important explanation.
Okay. So just to follow up on this, one thing I suppose, was observed, at least in the case of Italy. So I was talking to another colleague, and he brought up this idea of intergenerational transmission. So the idea that you might be young, but you interact a lot with your parents and aunts and uncles who are much older, and then you get kind of a rapid transmission. And this, I suppose, has been advanced as potentially one mechanism for why in Italy you had this rapid spread and also much higher mortality. Is the experience in Germany very different in, at least, let's say, just the dynamics of the interactions between young and old?
It's certainly different than in Italy. Italy is, I think, the country which has the highest share of multi-generation households in Europe. So people were younger people, and their kids live together with the grandparents in one household. And obviously, if you have much, and I think the share of multi-generation households in total households is something like 5 or 6 times larger in Italy compared to Germany. And so in Germany, it has one of the lowest rates. I think only some other Scandinavian countries have lower shares of this in this respect. So I think that also plays a role, obviously, because if you're living with more people in the same household, so also total household size is larger in Italy. Then you have
It's an interesting trade-off when you think about it. It seems like it was a risk factor. The population demography of Italy, it was a risk factor that household structure is often multi-generational. That makes sense to me. It's also the case that that in the US, and I think in a lot of other countries, where multi-generational households are less common, but the elderly population often lives in nursing homes, and and those have been a catastrophe, kind of, because you have sort of a high density of communal living, high risk population. It's hard to know what would be the better path if you could choose one ex ante. I don't know.
Yeah, that's right.
Italy was a pretty bad outcome, but everybody else got to learn off of Italy's experience, so it's a bit hard to.
No, exactly. So the big cases of fatalities in Germany was exactly that. What you just described, Cody. That there was a nursing home, and the nurse was infected, and then she was infecting many people living there, and then all of a sudden 20 or even more people died as a consequence, because it was too late then to do something. So that's clearly that you get these single events with many people dying. But it's indeed hard to sort of, I guess in the beginning, it was the German model was in that sense more successful because it limited the spread to a bit, whereas in Italy the virus was
really
spreading
fast,
a lot. Yeah, and I mean the other issue is, of course, or you also mentioned that Germany was benefiting from the Italian experience. So we were basically lacking 10, 14 days behind in terms of number of cases that we were discovering. So we could see what's working and what's not working to some extent. And I mean, this was already sort of the second wave of discoveries. We had the first cases of COVID-19 in Germany in January, and they were all there, they were all tracked and isolated, and that worked relatively well at the beginning. But then with this second wave, because it was affecting many people that went skiing in February, during skiing holidays in February, then this was spreading through the whole country. And that was much harder than to contain. And as I said, it was the way the social structure, but also the people that go skiing that were infected, that helped, that we didn't get too many fatalities, but we could also start implementing other measures, and we're learning from the Italian experience.
Okay.
So, Andreas, a lot of your work personally so far has been not about the health effects or models of how the virus has been spreading, but on just the sort of trying to quantify the economic implications of the epidemic and the response to the epidemic. Can you tell us a little bit about that work and what you take away from it so far?
Yeah, so the main takeaway is that this will be a very tough recession, the deepest we have had in Germany since World War II. So that's pretty clear already, but we don't know how deep it will be, because it's still way too early to tell. What we do, obviously, so we in my center at the Ifo Institute, we're involved in macroeconomic forecasting also for the German government. And when we were about to release our new forecast for this year in the middle of March, looking at all the data that we had, which was basically data from April, from February to some extent, we were about to, using our standard tools, we were about to predict the best year Germany will have in several years. And we knew that this is not going to be right. So we had to come up with some other ways of doing this. And one thing what we do is we have a monthly survey of about 10,000 German firms, and we ask them what is your current situation, what are your expectations. And we started in already beginning of March introducing special questions on how they will be affected by the corona pandemic, and which measures they undertake if they fire people and so on. And this obviously then this data comes in more or less in real time, and so we can use this data, and that's what most of our analysis is based on this type of data. So asking firms about what is their current situation. And then we try to build simple models, or rely on starting with very simple models, like where we basically national accounting, where you look in which industry, how many firms are affected, which share of firms, by how much do they think they will reduce the output, and then using some input-output relationships, also see which other industries will be affected, and so on. And then trying to quantify the scenarios. And the first scenarios we computed lead to a range of GDP losses between 6 and more than 20%. So you see, I mean, the huge ranges, and this is not including like confidence bands, so like, or error bands for the analysis. It's just the point, the range of the point estimate, so to speak. And so it shows in what interesting times we are living. And I'm sure in a few years back we will look at these numbers and laugh a lot and think, oh, how off we were. But this is this is not something.
Forecasting is a difficult challenge for sure.
Yeah.
So, there's a lot of kind of impromptu conversation that happens on Twitter or by email, I think, between economists, and there are a lot of catchphrase conversations about whether, I think everyone agrees there's going to be a really large drop in economic activity, however you choose to measure that, whether that you use a kind of employment-based measure or an output measure or whatever. Then people like to get into conversations about whether that initial drop will lead to a fairly rapid recovery, or whether it will be a kind of lethargic long path to back to normalcy. And one Twitter conversation, and I think there might be a working paper lurking in the background to this kind of statement as well. But one line of argument that I heard was that it might be a relatively rapid recovery, and that the proper analogy here to have in mind is that the whole economy is about to go on summer vacation, and it's not a happy vacation this time, but it's very similar in that the economy, many national economies around the world do this, especially in Europe, go on summer vacation, basically shuts the place down, and no one thinks it's a recession. You arrive back and kablam, like right back to regular output, and people can plan for it and so on. Is that what we have right now? There's going to be this vacation period. Supply will kind of drop, but then it will just instantly materialize again as soon as we invent a way to safely go back to the office. Or do you think there's reasons to think that that's not the right way to organize your thinking about it?
So I guess the quick answer would be yes and no. So I think
that's a good economist there.
It depends, as always. No, I think it's in at least obviously in theory, but also in practice, it's true that it's like we hit the pause button on the economy to some extent, and then if we hit it again, we can run again, and everything should be fine. That's true, and especially if it's not taking too long. This is true for let's say, if we think about especially the industry producing goods. But it's certainly not true if we think about service sectors, like especially what we could call social consumption. So I don't think that after the summer vacation if I don't go to a restaurant or to the cinema during the summer vacation, I don't think that I go twice as much after the summer vacation. Maybe I go back to normal. So there will be revenues and incomes lost. And this obviously then has potential spillover effects, because if incomes are lost, it depends on if people are compensated by government policies or not, and what happens. So this might be that especially certain restaurants, for example, or other companies might go bankrupt. So there will be jobs lost permanently, and this will have consequences. But I think the more important thing is that we potentially will see changes in our behavior. So one way is now we are seeing that this is working, doing it by Zoom. I don't know how many podcasts you have done via Zoom in the past, but this is now working, and also online seminars are working. I was counting last year in March and April, I went 8 times to Berlin to consult a German ministry. And I was always traveling for one day, going in the morning, going in the afternoon. This year, I haven't been to Berlin, and we all do it online, and we do video conference calls, which was not possible last year with German ministries. And so this is now possible. So I potentially won't, and this will potentially last. So I don't think I will go as often to Berlin in the future, which is good for the environment, which is good for me being more at home, but it's bad for the airline companies, the train companies, and also the people running shops at the airport or at the train station, because I don't go there, I don't buy breakfast there, and so on. So there will be changes in behavior, but also in terms of, I don't know when we will be able to go back to certain type of activities with very close personal contact, and this might take until next year, and then there might be a permanent change in behavior. And I think that's what's different to a summer vacation, where you also might come back with a fat belly or something from not doing anything and eating too good food in Italy or whatever you do for your summer vacation. But that's certainly different.
Yeah, so that's interesting, because I was wanting to ask you about this piece of it, because we've heard, so I was talking to another colleague who mentioned that drive-in cinemas in Germany have rebounded. We've seen cases in Holland where restaurants now have these diner-specific rooms, is what I will call it. And all of these are, you could call it, substitutions or changes that are being made to accommodate the new risk factors involved with kind of social consumption, as you might put it. And I was kind of curious to know if you expect this to kind of persist in Germany, or if you expect people will just eventually return to the norm. It sounds like you're saying we might see some permanent changes in the way people consume certain types of goods and services that they normally consume.
Yes, and it's not only the way sort of the demand driven, but also supply driven, because now the restaurants are changing what they supply and the way they do it. So what they offer, like you said, there's certain delivery types. There are now Michelin star restaurants in Munich that deliver their Michelin star 7-course menu to your house, and so it's. I mean, I'm not sure if I like this, so we haven't tried this. I was actually thinking this for our wedding anniversary tour, but then my wife vetoed it and said no, she doesn't want to. If she wants to have this experience, she wants to actually go to the place. Yeah. But I was considering trying it, and I mean, some of these things might persist because some people actually like it and then might demand it, and
yeah.
So
but I see, Andreas, your house, the restaurant is part of the consumption bundle, right? So
of course,
you can replicate the food, but you can't replicate the ambiance of the restaurant. So
yes,
I can see why the veto was implemented.
I mean, it's the same. It's true for a beer garden in Munich. It's not just about drinking beer. It's also about the experience in being in that place. So I guess we will see some of these things coming back and being as before. But others, there will be some things which people will like, and I mean, it's also in terms of digitization of businesses, but also public administration. So usually, for example, if you had to get a new passport in Germany, you had to go to some place, and all of a sudden you can do it online. So you can, I mean, it's and I guess those
things. It's hard for me to see that as anything but an advantage personally. I mean, we were probably going to, in many countries, we were going to eventually move in that direction anyway, I would think. And maybe it's costly to do it suddenly with little planning and people don't get to adapt. That's economically costly, of course. But maybe we were headed to that new equilibrium where you wouldn't go in person to get your passport or get your documents or something like this foolish waste of everybody's time. You could just send the information,
exactly.
So I can see it. Maybe some things are impractical to do that way, and you do need a sort of physical contact, but we probably were relying too heavily on that already. Same thing with your trips to the city to meet in person. There are advantages to meeting in person. Obviously. Some things are easier to explain when you can see each other and convey more information with your body language and so on. But in a lot of cases, it's not so obvious why you can't use Zoom or email or something like that.
Yeah. So I wanted to ask another question on the economic modeling, because at least the models that I've looked at so far, it all seems to me that people are looking at, well, suppose we shut down for N periods, where N is just a sequential, number of weeks or months, and then we reopen, and then we have kind of this period where we will kind of slowly recover or quickly recover, and then we're back to normal. But you also see from the health side that there is talk of, well, there's this initial wave where you shut down things and then you kind of slowly reopen, and then a second wave comes and you have to shut down again. And so it seems like, shouldn't the models account for kind of this N shutdown periods where, they're not all running consecutively. You just have a shutdown for a month, you open for a month, you shut down for another 2 months, and then you're open again. Like, how does that change the story? Does that mean we have a much deeper recession than is being predicted by these models where you have like 2 months of shutdown or 3 months of shutdown?
Yes, it's a good question. So most of the analysis we've done so far is indeed we are looking at this shutdown and then a recovery. But as you already said, so there's a shutdown period and then there's a recovery period, and then we are back to the old or new normal, whatever we assume how it continues. And indeed, if a second shutdown would come, it's not just like having one shutdown for 1 month and another for 1 month is not equal to having one for 2 months, because they're typically, and we also include this in the modeling, there are fixed costs of shutting down and restarting the economy, and so that's why it's not equivalent. And what we hope is that there won't be that we don't need a second shutdown if we do it correctly, if we get it right this time. And so we just published something today in German so far only, but we hope to have at least something in English to share with you at some point, where we combined, we did this together with medical doctors and epidemiologists from a center in Germany, where we combined their model of the spread of the disease and infection rates and number of fatalities with our economic model. And the idea would be to bring down the number of infections to a rate such that track, trace, and isolate would work. So we are talking about 100 or 200 infections per day, not new infections per day. So something like this, and then we can, then we would not need a second. We would not get a second wave if this works perfectly, and if we have the right app, and to see how long does it take to do this and to get the numbers down. And so we simulated different scenarios of reopening the economy or even shutting it down further, and then try with their model. They could try to, or they quantified what this means for the number of infections and then also the fatalities. And we combine in our model. We use this basically the duration that it would take to get to this target of let's say 200 infections per day. To see how long this shutdown would need to last, and to see what are the costs of this. And so it turned out that actually the current policy that we implement. So we started the model basically in April 20th, when the economy was still in full shutdown, or the strongest shutdown, and then they started some recovery model. Some recovery and some reopening of certain types. And so I think what it shows is that at this point already we were at a good pace, but some small reopenings were both beneficial in terms of the economy for sure, but also in terms of a number of fatalities. This wouldn't cause much of a problem. But opening it up way too much and quicker, that would both be damaging for the economy and would increase the death rate a lot. So and there's in these medical epidemiology models, there's this reproduction number that You've probably heard about this RT. And anything above a value above 1, actually above 0.9 is not good, both in what's interesting, both in health terms, but also in economic terms. Because if you open up too quickly, then you will get this second wave. And if you have to shut down again, the costs are way higher than when you need to shut down a bit longer now.
Okay. This is super interesting. I have two. It sounds like the newer work, it has a greater richness to it in terms of ability to think about different scenarios. And the previous work is more blunt, but it's also easier to just describe, right?
Yeah.
So that as I understand it, you guys have had sort of 3 generations of, and by 3 generations I mean like, I don't know, in the last 3 weeks or something, you did 3 things. It's pretty good.
Yes.
But so your first cut of it was the most blunt version was just to look at, basically national income accounts and pick sectors of the economy and just reduce their output by some amount, saying like that's how much they'll have to cut back. Maybe they go all the way to 0, maybe they do half, whatever you decided, and then tally everything up, and that was your view of like cost or decline in output. The second round was to do that again, but then exploit linkages that we already know about the production process, that industry X output goes to industry Y, which affects their output. So if the first one, it's sort of a loose model of the supply chain, right?
Exactly. Yes.
Okay. And then now the third wave of your work is still some of that, but now you want to link in the idea that as you allow certain types of activity to occur, so you increase production, you will likely produce more transmission of the disease. And so how quickly can you, or which parts of the economy can you kind of open without raising R above a level that will cause a second wave? That's the summary. So I have these questions. Is there a way that you can describe or put numbers on how much incorporating the supply chain effect alters the costs? So I think people were initially kind of worried about this, or at least surprised here in the US anyway. Maybe it shouldn't be a surprise. We all know these things, but grappling with it is a strange experience. That many of the things that you want to buy, and you're used to be able to go on Amazon and just purchase on demand at any moment, some of them are just not available because there's an international supply chain that's been disrupted, and there's just not coming to you. How much of the economic decline that you're sort of modeling, how much of it comes from that sequence of supply chain actions versus just the gross decline in each sector's activity? Is that a question you can answer, or is that too ill-posed to really?
No, it's it's a very good question. I don't know. I do not have the answer in the sense that it's 10%
or something, yeah,
110% or whatever. Obviously, it's important, and every step, every refinement of the model shows also new things and accounts for new aspects. But it's certainly that, especially so for Germany, we are a very open economy with lots of trade. So it's this international trade flows are important, but also the dependence of different industries on something. So, for example, the automobile industry in Germany is producing or stopped production because they didn't get supplies from Italy, from northern Italy, where a lot of suppliers are. But also because the supply of certain types of, Germany has a textile industry which is basically producing, let's say, carpets for cars. So, and it's relatively large actually, but they are relying a lot on stuff coming from China. So they were in trouble, so they couldn't supply the car industry, and so the car industry got into trouble in the production process. And so there are lots of these linkages.
And those kinds of linkages, your model-based estimates can accommodate. You have information on the car carpet manufacturing sector and its linkages
Yes.
to Chinese production or something like that.
Exactly.
That's part of the model.
So that's part of the model, or I mean, right now in a very rough way, and we are working on further developing the model. So as you saw, every week there's an update of in one way or another of this stuff, and the model gets richer and richer. But we know, so we have in our business survey, we are asking these firms. We have many of these carpet textile firms actually, because they are the single best industry predicting the German economy, because if their expectations go down, this means that the car industry is really not doing well, and which is the single most important industry in Germany. So this is actually the single best leading indicator for the German economy is this automobile supply industry.
Interesting.
Yeah.
Okay. Okay, probably matters a fair amount, and maybe functions as a leading indicator. That's interesting. So this is a similar question. You probably can't give a precise answer to, but maybe we can talk about it. It seems like the most recent work, which is an attempt to sort of integrate an epidemiological model with a kind of macroeconomic framework. That is the kind of platform you could use to start thinking about what are the policy restrictions or policy restrictions that you could lift or step back on. What are the restrictions that you could lift or impose which would have the largest effect on the transmission of the virus, but the smallest economic disruption? Have you thought about that? Like, what specifically are the kinds of things you could do that would, in the model anyway, keep the transmission rate low, or the reproduction rate relatively low, but would get us a big boost in economic activity? Kinds of interventions fit the bill there. Anything?
Yeah, I mean that's a very interesting question again, and also or thought or suggestion. So we are thinking along those lines, but this is let's say a macro model of the economy and a macro model from the epidemiologists also. So it's basically the policy that we can implement there, or the only policy is sort of something like social distancing in large. So we reduce the number of contacts between people, and this reduces the infection rate.
But it's not rich enough yet to say reduce the contact rate among workers in the car industry.
No,
that's too detailed still.
This is something that we don't have looked at this right now, but this is something that could be done. The problem is I'm trying to get data. I haven't seen any data on this, on what is, let's say, some ratio or share or importance of personal interaction with your co-workers and also with customers or other people for a given job. I mean, there are some, I haven't seen any, let's say, hard data on this. I've seen some, tried to find something. I've seen, obviously, there people say, okay, if you're working in retail, you probably have more contact than if you're a forest worker or whatever. But
so in fact,
somehow to quantify
in the
this.
US, in the United States, and I imagine this is probably pretty applicable to other developed countries too, but I don't really know. But in the US, there's a thing called the ONET, which is kind of a dictionary of occupations. Yes. And so in a working paper that some of us at SPIA put out earlier in the week, we used the ONET for each occupation to sort of score it on a few different sort of COVID relevant lines. So one of them is an index that tries to measure how much this job requires you to have face-to-face interaction with clients and coworkers. Another one is how much does this job involve activities that could be done remotely? These indexes are, they sound nice. they're a bit dodgy, right? So like, you know, the one, do you work at home? It seems good enough to me, or reasonable to me, but it probably doesn't capture the full richness of somebody's job. But there's underlying it, there's some survey questions that were asked to workers in that occupation once upon a time, saying things like, how important or how often, how much of your work involves email or written memos and letters and things like that, or phone conversations. So industries where the people answer that kind of work is a lot of their time, they score high on this remote work index. Other ones are lower. Likewise, the face-to-face ones, there's a series of these questions and we average them together. So we have some of those, and it looks like in the US, the recent job losses are lower for occupations, for people working in occupations that have higher scores on the remote work. So they work at home, seems logical. And there's worse job losses in occupations that involve a lot of face-to-face contact. So indexes like that, or information like that, might be one way to try to, you know, you need to take them and then embed it in a model, like, you know, but
exactly. So we would need also to combine this on for our type of modeling on the industry level. So to see, so go from occupation to industries, and then so that's why. So I started looking for this last week or so, and we are aware of the ONET, or I've used it before, the German version of it, obviously, which is basically the same, but done with it based on a German survey. And yeah, that would be one way to go, and then to actually to see which of these industries. So we know for this home office, being able to work from home, this has so both the share of people who do it, but also the potential for these jobs. This is available also already on the industry level. So they, in one way or another, and we started to look into this, to use this for also for at the beginning of the crisis, when we did this what you said, the very blunt and rough early versions of the model. In the first version, we also were making assumptions by industry, and there we were using this. We were saying, okay, in which industry there's a big potential to work from home. Like, I mean, in our jobs, we are not affected at all, except that we are not able to meet each other. And but that's not possible in many other occasions. So we are using this data, and we plan to use this in the future also, to be able to say, okay, we need more, if we do social distancing in industry A, that's more important than do it in industry B. But then also saying it, if it's in industry A, the way you implement social distancing might be completely different than in industry B. So it really depends on what type of, do you have face-to-face contact with customers? You might need different protective measures. Whereas if you have contact with your peers because you're sharing a desk, then it's probably something different what you can do by just saying you don't need to change anything in the workplace. You just need to say one person comes every other day, and you work the other day from home if you don't need to talk to each other or stuff like so.
It seems like you guys are making good progress. It seems really valuable to be able to think about what would the value of coming up with a social distancing plan for a particular industry or occupation type or something like that. What would be the economic value of that? Because, like, you can imagine there might be some occupations or industries where it's easy to do work from at home, and they're doing it so they're not contributing much to the loss except through indirect channels. There could be other ones where you think they don't work from home, but it seems very possible that they could. So they could make a plan and get that happening with some effort. How much improvement in economic activity would we get for that big change? In some sectors, maybe you'd be like, hardly any. They should just stay not working. It won't do anything to get them back in, or we wouldn't spend a lot of money reorganizing that one. But maybe there are some other industries where we should really put a priority on finding a sort of safe workaround in that industry because it could have a big economic effect. Maybe the obvious answer is just like in Germany, the automobile industry is the one. And that's the end of the conversation. I don't know, but like probably it's more complicated than that, right? I mean, it's
yeah. So I was thinking it's probably complicated by the linkages that you mentioned before in the car industry. The manufacturers themselves, but also their suppliers. You talk about those that produce the carpets. If producing the carpet is one place where you can easily enforce social distancing, but the car manufacturing process is one where you cannot, then opening the carpet production will probably do very little because you're producing a bunch of things that you can't sell. Or the reverse, I suppose, is also true. I mean, the car manufacturers are open, but they can't get their inputs. So that you would have to account for those kinds of linkages as well as you think about where do we open and the potential economic impact of that opening.
No, exactly. So it's certain things which, and it's really, so it's the importance of an industry, obviously something like in terms of maybe number of employees, but also output, productivity, output per employee, something like this, where we should look at, and but also indeed the linkages with other industries. And I think a good example is where it's very hard to implement social distancing is childcare of small children, of toddlers, of babies, where if they are not open, obviously their parents cannot work, or not to the same extent if this is if you don't have childcare. And then this has spillovers on potentially many industries, because the parents obviously work not of small kids, do not work only in one industry, but in probably in all industries. And so
yeah, that seems like high potential for if you could come up with a safe way to do childcare of younger children, it would have large economic implications. I bet that's true.
And this is also not something that you can do
one of the harder
Zoom.
ones to pull off, right? I mean, how do you keep the little kids from interacting with each other? Totally impossible.
And it's clearly also something that cannot be done online via remote work. So
that's a tough one.
It's a hard one.
Yes,
I mean, kids naturally gravitate to each other. It's hard to keep them apart. So, but fortunately, they're one of the, I guess, more resistant groups. So that's probably helpful.
Yeah, it's true that the risk is not so much for the children themselves, but that they can still spread the virus. And I mean, there are discussions on whether this is how much, to what extent, and it's still not clear from a medical point of view. And there could be some children could be immune against the virus if they had previously coronavirus infection, so some other type of coronavirus, which they typically get during the year several times. So most of the infections children get in daycare units are actually other type of coronaviruses. I didn't know that. And it could be that there's this, how do you say, cross immunity. So if they had 2 or 3 different virus and coronavirus infection, they might be immune against the new one, but we don't know yet. So it's a theory, and there seems to be some evidence, but as the evidence is based on, I don't know, 15 observations, as it's typical in medical studies. So it's not something what we should use to make to say, okay, now we can open up all daycare units, because based on n equal to 15, this is
very hard to speed up that kind of research, right? I mean, it's 15, it sounds unimpressive. It's how they get there, like,
yes,
they're not used to having to try to like come up with an answer in 6 weeks. That's not that helpful.
Yes.
But eventually.
So I want to kind of move us along a little bit. I want to touch one more on kind of the economic impacts. So we know that the labor market in Germany, at least the laws governing labor markets in Germany and Europe, I suppose more broadly, tend to be very different than in the US. I mean, generally more restrictive. So I was curious to get your feedback on how the labor market has kind of held up to, the pressures that are being placed on it by COVID. Are firms able to react very quickly, or are these laws kind of restricting the extent to which they can easily respond to the changing economic climate?
So, I mean, in general, I think the big difference in Germany or in most European countries to the US is that there are strong regulations on firing people. So it's not so easy just to lay off people quickly. You can lay off people, and an economic downturn, a recession, is one of the few reasons which are broadly accepted, also both by law, but also, let's say, by the public. But usually you don't do it. You cannot fire people immediately, but you can tell them we're going to lay you off, but this will only be effective in, let's say, 3 months, 6 months. This depends a bit on, mostly on tenure in the firm. So how long you've been in the firm. There are also different types of contract, like permanent contracts and some limited time contracts, and other type of special rules. But in principle, it's like you can lay off people in a recession and say, but this will only be effective in, let's say, 3 months or so. The other thing is that instead of laying off people right now, there is this policy which is called short-time working scheme, which means that instead of temporarily or permanently laying off people, you can say, I put my workforce or some people from my workers, some employees in this program, and this is. And you define the reduction in the employment. So let's say if instead of 100%, they work only 50% or 10%, or even you could do it 0% working, which would be something like a temporary layoff, I guess, in the US. But the difference is that you keep your job, and your income is replaced according to the rules of the UI system. So, which means that you get for the reduction in gross income, you get a replacement of 60, 67%, depending on whether you have children or not, of your net income. So you're staying at home, but you get some replacement income, and then especially most of the firms don't go to zero. So let's say they reduce the work to 50%. So you get 50% of your normal wage, and then 67% of the other 50%, so 33% of your net wage as a benefit from the government. Okay. And this has, especially this sort of being part-time unemployed, you could call it, with some benefit. This has several advantages, I think, because people are still staying in their jobs. They still continue to work, and they receive some replacement income if they are out of work. And this is something which was, this policy has been in place in Germany basically ever, but it was used heavily and extended heavily in the Great Recession. And I think that at that point, it was the main reason why we didn't see an increase in unemployment in Germany from 2008 to 2009.
That's really interesting. So you have a kind of an unemployment insurance system that will do partial wage replacement. So if your firm cuts back your hours to 50% or 75% or whatever, you could get the wage replacement for the share of the hours reduction. And there's some definition of what if you're full-time, you're supposed to have whatever definition of is your normal amount of work. That's predefined. That's pretty neat. So can you see, so here in the US, you get one of the pieces of data about the labor market. The labor market data comes out much slower, and one of the pieces of labor market data that I have in the past never paid any attention to, but is now interesting, are the weekly initial unemployment applications. How many people applied for UI benefits in each state each week? Comes out every Thursday. And there was just an astoundingly large increase. Like in the history of the series, there's never anything like that, right? That happened. And those are all in the US, as I understand it, you can only apply for unemployment insurance if you actually lose your job entirely. There's none of this, if they cut back your hours, you can't apply for partial unemployment insurance. There's nothing like that. And normally, maybe we wouldn't want that for incentive-based reasons or something, I don't know. But right now, it sounds like a great idea because you'd like to keep the employment relationships intact if possible and turn it into more of a vacation period. Have you seen, does data like that come spewing out of the German administrative system as well? Do you get weekly updates on how many people have joined the unemployment insurance rolls and under what basis, like full wage replacement versus partial hour replacement, that kind of?
Yes.
Is there information about that? Yeah.
Yes, there is. So it's like it's basically these are technically these are two different, let's say, benefits. The one is the unemployment insurance system or benefit, and the other is called in German Kurzarbeitgeld, so this short-time working benefit. And so we see both. Unfortunately, we don't get weekly updates. We only get monthly updates so far. We are pushing the agency to change this, obviously. And so
normally no one cares to have weekly
yes,
updates.
Exactly. So it's what we've seen is that there was a small increase in the normal unemployment insurance. So we are talking about a few 200, 300,000 cases. These were mostly contracts that were not renewed or very relatively small contracts, but we saw an increase. So so there are two numbers. One is the number of so the firm has to notify the employment agency that they want to put people on this short-time working scheme, and they have to indicate how many workers they want to put on this. That's the first step to initiate this process. And then the employment and the firm also has to prove that they are in a bad condition. So that it's not, you cannot do it if you just have one worker and you want to reduce the hours for one person. It has to be, it used to be a quarter of the workforce, and I think they've reduced it now to 10% of the workforce or something like this. But whatever, you have to document that it's affecting your whole business and that you want to do this. And so these notifications we got, this was also an all-time high with about 10 million workers. So that's about a fifth, or actually a fifth to a quarter of the workforce that was put on this. So a huge effect. That the actual number of workers in this program is much lower because it's, but there the data is also lacking behind. So we are asking the firms in our surveys, and we are asking about these reductions. And also this doesn't mean that all of these, even if it were 10 million workers, that the reduction would be 100%, but it could also be, if it's just a 10% reduction, you can still be put on this program. So we are waiting for this, the exact data on what's going on and how many firms are actually using this right now. But it's huge, but it's also, I think, important because I think in Germany especially, because also of population aging, many firms, especially in the industry, in the manufacturing industry, they are actually searching for people with certain qualifications, certain training. So this type of labor hoarding, I think it's actually it's a good way for firms, and the firms have the incentives to do this. So, and obviously, not firing the people is better from a distributional point of view, but it's also potentially more cost efficient because you don't.
Well, it might make the fast recovery more possible because you don't need to go in. Yeah.
Yeah, you don't need to search new people.
Exactly. It does seem like a good idea, I think. I mean, unemployment insurance in general has some features to it that seem helpful in a kind of semi-automatic way for dealing with an epidemic. Yeah. Primarily by, normally the sort of sort of jaded economics view of an unemployment insurance program is that there's a sense in which you're paying people not to work, and that's bad, and could make for longer unemployment spells and so on. In the current moment, we want people to stay at home and socially distance, and one reason why they might not is that they need money in order to pay their bills and live the rest of their life. And so, how are they supposed to stay at home? The UI benefit is basically a subsidy that's linked to you staying at home, or at least not working, which is one of the main reasons you would go out in the world, I guess. So that's interesting. And trying to do that rather than on a binary basis, like employed or unemployed, trying to do it on a sort of continuous scale seems
beneficial.
Like it has some optimality ideas wedded to it.
I agree.
So I think, so I was going to try to shift the conversation now, but it's, kind of related to what we've been discussing. So clearly, if you're going to implement this type of social insurance program or unemployment insurance program, it's going to require dollars, right? The government needs money to cover this shortfall or to replace income for wages. So I was hoping, that you would probably discuss with us kind of the fiscal impacts. So we've talked about the impact on the economy, and that economic reality requires some fiscal stimulus. So what kinds of effects? So two parts here, right? So one is, how is this affecting budgets, right? So you cut back in economic activity, you're basically shrinking the tax base. And so how is that affecting, let's say, federal, but also the landers? And then second, governments are responding to this crisis by, replacing income, trying to beef up healthcare provision and so on. And that also has some fiscal effects. So can you talk a little bit about what kinds of packages were implemented? What's the landscape looking like fiscally for German states?
Yes, so it's obviously an important question. It's clear that this is not a cheap program in the short run, but it's actually better in the long run than just being like, if the people are fired now and if they relative to if they stay on the job, in the long run consumption could be higher and they will pay more taxes. But so in general, how does it? So obviously this depends on the type of model you're thinking of, but also on the development. It's probably hard to assess. So in general, you're right. So the good thing of being a bit more a high tax country is that we have high automatic stabilizers. And so this means that if the economy goes down, obviously the economy is a bit stabilized a bit more by the reduction in tax revenues. But this is clearly bad for the public finances. So we will see a huge drop in tax revenue for this year and probably also for the next years to come. And on the same, if unemployment goes up, if this benefits goes up, we also see an increase on the cost side, again, as part of the automatic stabilization of the economy through the tax benefit system. And this will cost us a lot, that's clear. And the other thing is that the German government reacted very quickly and I think very strongly by implementing a big program, a spending program. So they announced a lot of liquidity support for firms, but also some cash transfers to certain type of households. They've extended benefits, they've cut or deferred some tax payments, a lot of things. And on top of that, they provided direct credits, possibility for direct credits to firms and also guarantees for credit. So this was so far already what was just announced in March, I think, was also the biggest stimulus program ever or since World War II, since we sort of have data on that. So
I read a little bit about this. It sounds impressive in some ways, not just that they reacted, the German government has reacted quickly on this kind of response front, but it also seems true that more than some countries, it's always hard to do this, but like if you think of like the very old or undergraduate level depiction of Keynesian macroeconomic management of things, the story is supposed to be that like you run a bit of a surplus in good times so that you can run a humongous deficit in something like this, and that's your plan, kind of. There's a sense in which Germany has managed that this time, right? Like it's not like heading into this you were already running a deficit. In some sense, you are prepared to spend a bunch of money because in the past you have been, since the Great Recession, you've been more stingy on other fronts. Do you think is that accurate, or
Yes, that's true. So the debt to GDP ratio after the Great Recession was above 80%, and it was in February, or it was below 60%. So it was really bringing down. So there was some economic growth, but it was also really running surpluses and especially the last years. And there were big discussions actually now going on whether the policies were too tight, whether we should have had more public investment, public spending, or whether we should cut taxes. And there was a tax reform, a tax cut plan for next year, which would have sort of, I guess last year the surplus was something like close to 100 billion euros or something. In total, and the tax cut would have been a fifth of that or something like that. So there was still discussion about more money to be spent, and now it's clear that we know how to spend the money, but it was I think the German finance minister, he was saying something like we could pull out the bazooka, or we have the firepower.
He looks vindicated right now, for sure. Right.
So and that's sort of because that's what we were being preparing for a crisis to happen, and now we are prepared and we can do whatever it takes to save the economy. And I think that this was also an important statement that the German government went out very quickly and said, look, we are ready for this. And I mean, even with all the measures that are now planned and the tax cuts, the forecast is that the debt to GDP ratio will increase to something above 70%. So it's really a huge impact, but we are not even at back to the levels at the Great Recession, and that was also sustainable. I mean, given the current interest rates on German treasury bonds, that's we could still do more. We could do the same thing again if we feel it's necessary, without risking anything.
So that's actually
obviously
no. Go ahead. Finish your thought.
No, I was saying. So I think it's that's something which will be interesting in the debate forward, especially in Europe, because we know that especially Italy, but is very much constrained on this, and they could do certain things, but there will be big discussions in the Eurozone, in the European Union, about helping other countries, bailing out other countries, and there are some plans on having joint Euro bonds or Corona bonds and stuff like that. That the other countries also benefit from the low interest rates or the negative interest rates actually for German treasuries.
So that's where I wanted to go next. So you kind of preempted me a little bit. So because I know the U.S. situation is very different, right? I mean, we were kind of running huge deficits leading into the crisis, and now we're spending a lot of money, so deficits kind of blowing up as well. But you know, one important difference between the U.S. and Germany is that Germany is part of this larger bloc, right? And so there's the European Union and all the rules that come with that Germany is also expected to follow. So I wanted to get a sense, or at least some impressions from you on the extent to which those European level rules are either binding or not binding in the case of Germany, but then how does that compare across other European countries? And it sounds like what you're saying is, at least in the case of Germany, you're probably not as constrained as maybe some of your neighbors.
Yes, exactly. So, I mean, obviously, there are different types of rules, but I think the most important difference also, maybe let's start with this, between the Eurozone, the European Union, and let's say the United States of America, is that this is, I mean, it's a union of independent states. There's a sort of central government in Brussels with some budget, but we are talking about maybe 1% of GDP or 1% of the total budget, and not like, I think in the USA, it's something like 2/3 of the total budget are decided at the federal level and 1/3 at the state level. And whereas in Europe, it's 1% of the budget at the federal level and 99% on the national level. At the level of the member states, and I think that's a key difference. So there are certain rules, and in order to get certain help or certain shares or some stuff from the budget, you need to follow those rules. But I mean, in the end, if you don't follow it, we are not talking about a big chunk of the budget that for each member state. So it's and obviously there are some other things, and the government in Brussels, the European Commission, they can tell you, oh, you are a bad boy, you didn't follow the rules, and we punish you to some extent. But I mean, if that's what happened in the early 2000s. Germany and France were about to punish, and both governments said, we don't care. We are a big country. We are more important for you guys than you are for us. And this is different this is also true for Italy. This is different for smaller countries like Greece, for example. They couldn't do it after the Great Recession because, I mean, Greece is very relatively small. They have something, I don't know, 8 million inhabitants or so. So it's even if Germany could have taken over the whole Greek debt, which has a very high debt to GDP ratio, but Germany could have taken it over, and we wouldn't have had to raise taxes or anything. So it's that's why these rules are to some extent important for the smaller member states. But if in case of Italy or Germany or France, they are not really binding. And but obviously what's then important is there is some market discipline coming via the financial markets, obviously. So if you incur too much debt now, then obviously your interest rates, the spreads will go up. And this was the case, especially in the case of Greece, given also that it was so small. The market could bet against or in favor of Greece going bankrupt, basically. That's also not really possible to the same extent with Italy or Germany, because it's much larger, and so you would need much more money to put into such a speculation. So that's I guess what's different there. But it's true, obviously, that if we think about the European Union and European solidarity, this could also be the possibility for some further changes. And I mean, what we could do is we could push towards the direction of having something like the United States of Europe. And then this could be for the German government an opportunity to sort of not force, but to negotiate, to nudge other countries a bit into certain directions of reforms that they want, by saying, look, we are in a good position. We sort of let you participate from our good positions by allowing this type of euro bonds, corona bonds, or by directly giving you money. But that, because of this, you need to vote in favor of reform A, B, and C, or whatever. So these type of things might come up in the future. And interestingly, it will be so there's always one country of the European Union is running the presidency of the European Union, and it's the upcoming presidency will be Germany as of July. So I could see a lot of also this that this will be used for some institutional reforms then.
Okay, that's interesting. So
yeah, there's also a lot of political economy, let's say.
Yeah, that's where I was going.
Games around anyway. This.
Yes.
I mean, we kind of touched on this briefly before, but it seems, so the whole Corona pandemic thing is I would say on average just terrible, right? But it seems like, with every bad, there is some I'm going to say good. I know that might be a little bit normative, but it just provides the opportunity to implement changes that people probably thought should have happened anyway, and you just needed an impetus to have that change. So, for example, maybe not traveling to Berlin, 8 times in 2 months when you could have a conversation via Zoom is one of those things, or filing for your passport online versus traveling to a post office. And it seems here that in the larger picture of EU as a whole, that this might also serve as an impetus for changes. Okay, so I know we're coming up on the end of the session. I wanted to ask you kind of just one more question, and that has to do with, so you're talking just now about the relationship between the member states and the EU, but Germany is itself a federal system, right? And so, if you think about what's happening in the US, the relationship between the White House and some of the states, there seems to be this tension, or at least was. I don't know what the state is at the moment. Can you talk a little bit about the nature of the relationship between the federal government and the states? Has that shifted in any way in light of the pandemic? More positive, more negative, just the same? And how has that affected, kind of response to the pandemic?
Yeah, so the system in Germany is a bit different in the sense that there are certain things, obviously, also that the states can do, but most of the policies, or the important policies, are actually joint policies. So it's think about the income tax. So there's one income tax, federal income tax. And this is something that in the parliament, it's both houses or both chambers of the parliament need to vote on. So in the US, it would be the House and the Senate. And in the sort of the German Senate is something a representative of the different states, and the others is the federal level parliament. And then the income tax revenue, and the same is true for most other taxes, actually, the big ones, at least the VAT and so on. The revenue is then shared according to some rules of roughly 40% goes to the federal budget, 40% to the state budget, and 20% to the municipal budget. And there's no municipal tax, or very few, there's no municipal state level taxes, smaller ones, minor ones. And the same is true for many other policies. It's usually that the federal government either fully decide, or at the federal level for all states, it's decided on the one size fits all policy, or there's a certain framework that is agreed upon, and then the states can do minor adjustments within this framework. So this is true in terms of education, but also the same is now true in terms of reacting to the pandemic. It's basically there's a conference call between the prime ministers from the different states and the chancellor, and then they agree on sort of the framework, and then each state implements its own version of it. But so the differences across states are relatively minor. So especially at the beginning, they were more or less the same rules with very few exceptions. So in one state, you were allowed to keep a garden center open, and in the other state, you were not. And in one state, you were allowed to meet. If you go outside of your house, you were allowed to take a walk with one person outside of your household. In the other state, it was 2 persons. But something like sort of these minor differences, but most of the things are the same policies, and that's also that all the state governments are aligned with the federal government, because it's also in the way, in the end, it's sort of the federal government or the federal level that is paying the bill. So it's the way the system is organized, and so but obviously there's no. We have elections coming up next year, and Merkel had previously announced that she would step down as chancellor, and there was, in her party, there were basically 3 or 4 candidates as a successor, and 2 of them are prime ministers of states. So one here from Bavaria and one from the second big state, North Rhine-Westphalia, and obviously they are now or using this as an opportunity to sort of showcase their case. And that's something which plays a bit of a bigger role, and especially the one from Bavaria, Markus Söder. He seems to gain a lot in popularity in outside of Bavaria recently, because he's reacting very fast, and he's also making good impressions on TV, whereas the other candidates, they are not always up to it. But so he seems to be he also seems to be the smartest of those guys. So we will see whether he will win this, but he could be the next chancellor. I think if there were elections next week, he would win with a big majority, actually. So that's
okay. Well,
yeah.
Thank you very much, Andreas. I know we kept you maybe a little bit longer than we agreed, but this was this was a lot of fun. Learned a lot about the German experience, and maybe we'll have a conversation in a couple of months or maybe a year when you come tell us that your estimates were spot on or way off the mark.
They will be way off, but the question is how far. So thanks for having me.